We all know that 2020 has been a hard year, and it's ending in this festive period, which is going to be very different. After all the efforts that we've gone through to control this virus, and in many parts of the country, this virus is under control, just as we've got a tiered system in place that was able to control this virus, we've discovered a new, more contagious virus, a variant that is spreading at a dangerous rate. And I know that the vast majority of people watching today and across the country understand what we need to do together to get through this. And so today we're announcing further action within the tiering system and also some further progress on vaccines and on testing. And I just wanted to say this before I set out the details of what we're going to have to put in place. I know that these actions have consequences. I know how difficult it is, but I also know that it is right to take the action that's necessary to control this virus. Across the country, cases have risen 57% in the last week. The average COVID hospital admissions are 1,909 a day. That's the highest figure since mid-April. There are 18,943 people in hospital with coronavirus right now. That's almost as many as there were at the peak. And yesterday, there were 691 deaths reported. That's 691 people who have died just before Christmas. And our hearts go out to their families, their loved ones, as with all who've died from this horrible disease. I know the pain that this causes. So against this backdrop of rising infections, rising hospitalizations, and rising numbers of people dying from coronavirus, it is absolutely vital that we act. We simply cannot have the kind of Christmas that we all yearn for. Of course, it's the social contact that makes Christmas so special, but it's that social contact that the virus thrives on, and that's how the virus is spread from one person to another. So it's important that we all minimize our social contact as much as is possible this Christmas, and that will help protect ourselves, our loved ones, and the whole country. We've got to keep our resolve. We've got to keep going through this. And there's 4 areas that I want to update you on today very specifically. The first are those tiering decisions that I just mentioned. We know that the 3-tiered system worked to control the old variant and is working now in large parts of the country, especially in northern England. But we also know that Tier 3 is not enough to control the new variant. This is not a hypothesis, it is a fact, and we've seen it on the ground. We've seen case rates rise in some of the places close to where the current Tier 4 restrictions are, in places like East Anglia, where we've seen a significant number of the new variant, and we've seen case rates rise sharply. It is therefore necessary to put more of the east and southeast of England into Tier 4. We're also taking action in parts of the southwest, where there are some early signs of the new variant and where cases are rising. Even though case rates in some of these areas are not as high as they are in the areas badly affected, in London, for instance, and in Kent, the direction is clear and in many cases quite stark. The doubling times are short. And we have learned that when it comes to being a matter of when, not if we take action, it is better to act sooner. So from 1 minute past midnight on Boxing Day, Sussex, Oxfordshire, Suffolk, Norfolk, and Cambridgeshire, those parts of Essex not yet in Tier 4, Waverly in Surrey, and Hampshire, including Portsmouth and Southampton, but with the exception of the New Forest, will all be escalated to Tier 4. Bristol, Gloucestershire, Somerset, including the North Somerset Council area, Swindon, the Isle of Wight, the New Forest, and Northamptonshire, as well as Cheshire and Warrington, will all be escalated to Tier 3. And I'm afraid that Cornwall and Herefordshire have seen sharply rising rates and need to be escalated to Tier 2. This is not news that anybody wants to deliver, and I am truly sorry for the disruption that it causes. But I think people know how important it is that we take decisions like this to keep people safe and to protect the NHS. The second piece of news I want to tell you about is some developments about another new strain of this virus. Of course, the fight against the virus is a global effort, and we're constantly vigilant and looking around the world. And as part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The Chief Scientific Advisor and the Chief Medical Officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible, and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight, must quarantine immediately. By quarantine, I mean they must restrict all contact with any other person whatsoever. We'll be changing the law to give this legal effect imminently. Now, these measures are temporary while we investigate further this new strain, which is shortly to be analysed at Porton Down. And I want to thank everyone involved for the seriousness with which I know that they will take these new instructions. I'd like now to move on to some more positive developments. The third thing I wanted to talk about is an update on testing. As you know, we continue rapidly to expand the testing capability here in the UK. We're expanding community testing yet further in areas where the rate of infection is highest, so we can identify people, and especially identify the around 1 in 3 people who carry the virus without displaying any symptoms at all. 116 local areas have now signed up for this community testing, and we're in discussion with more. And these rapid turnaround tests are proving to be extremely effective at finding cases where we otherwise wouldn't. And I'm today publishing an assessment of the Liverpool community testing project, which shows how effective this can be. I'd urge anyone who has the opportunity to take part to protect their local area. And at the same time, we're boosting rapid testing in care homes with a further £149 million to support that effort. So all those who work in care homes in England will receive 2 rapid tests a week in addition to their weekly PCR tests. Finally, amid all of this difficulty, the great hope for 2021 is, of course, the vaccine. The vaccine is our route out of all this. And however tough this Christmas and this winter is going to be, we know that the transforming force of science is helping to find a way through. I'm delighted to be able to tell you that the Oxford AstraZeneca vaccine, developed here in the UK, has submitted its full data package to the MHRA for approval. This is the next step towards a decision on the deployment of the vaccine, which is already being manufactured, including here in the UK. We are, of course, continuing to deploy the Pfizer-BioNTech vaccine, which is being delivered now from over 500 sites all across the UK, and we're adding more all of the time and accelerating the rollout. I'm also delighted to be able to announce that we have begun vaccination in care homes. We know that people who live in care homes are amongst the most vulnerable to this disease, and I'm delighted that we're able to do this. Again, it's another enormous logistical challenge, and I'm very, very grateful to colleagues in the NHS and in the social care sector who've worked together so hard to make this happen. This afternoon, it gives me great joy to tell you that the Chelsea pensioners will be vaccinated, along with care home residents right across the country. I think we all need a bit of good news. And the reality is this vaccine programme is the way we're going to get through this, because every time somebody's vaccinated, our country becomes a little bit safer, they become a little bit safer, and we get a little bit closer to the life that we all want to get back to. I sincerely hope that this is my last press conference before Christmas. And I want to just take a moment, firstly to thank you and everybody watching for all that you have done and the sacrifices that you've made. And I also want to thank my whole team who've done so much, including those here, Susan and Jenny, but including the huge team in the NHS, in the department, and right across the board. As a country, we've been faced with these enormous challenges, and it's been very tough. But I especially want to thank those who helped this country to become the first in the world to roll out a clinically approved vaccine. I want to thank all those who've helped us build a bigger capacity in genomic testing than anywhere else in the world, and of course, the biggest overall testing capacity in Europe. I want to thank our scientists who've discovered the first proven treatment for coronavirus. And I want to thank everybody working in the NHS and in social care for the work that they've done this year, and also for the work that's going to carry on this winter. And especially to colleagues who are working over Christmas, which of course is so important in the NHS and in social care. Look, I know how hard 2020 has been for everybody. And after delivering some really difficult news, if I may, I want to end on a reflection of where we are as a country. This Christmas and the start of 2021 is going to be tough. The new variant makes everything much harder because it spreads so much faster. But we mustn't give up now. We know that we can control this virus. We know we can get through this together. We're going to get through it by suppressing the virus until a vaccine can make us safe. That's been our strategy, and that's what we must do. We're not going to give up now, especially after so much sacrifice. And I know that some of these decisions are tough, but I believe in that everybody making the right decisions, and I believe that everybody will do what is needed to keep themselves and others safe, especially this Christmas. And I know from the bottom of my heart that there are brighter skies ahead.